Time now for Morning Rounds. Joining us are CBS News chief medical correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up this week, new research shows that 3D mammograms detect more breast cancers than the usual methods. John?
That's right, Anthony. A new study finds higher detection rates and fewer repeat scans than traditional imaging.
44-year-old Lori Kaplan went for her annual mammogram using a technique that produced pictures in 3D rather than the standard flat images.
This way, they have such a better view that they see way more things than they ever could, and they're able to detect a lot more. And it hurts less, actually.
Today's study in the Journal of the American Medical Association reviewed more than 450,000 screening exams. About 170,000 included women receiving both the standard and 3D mammography. Those getting 3D mammography had 41% more invasive cancers detected and 15% fewer repeat scans to evaluate inconclusive findings. Dr. Nancy Elliott is the co-director of the Montclair Breast Center in New Jersey.
The study brings out that women don't have to be called back as often. So therefore, there's less anxiety.
Here is the regular digital mammogram of one of Dr. Elliott's patients. It looks normal, but the 3D scan shows a hidden cancer, one that was eventually removed. Kaplan's exam was clean, with no need for any further views.
I think that 3D mammography will become the screening tool of the future. I think it's important that women get the message that if they're going to have a mammogram, they should make it count.
John, this seems like a significant advance. Do you think 3D mammograms are going to become the new standard?
It's certainly a technological advance, Anthony, but the question is, will that translate to less of a likelihood of women actually dying from breast cancer? And that's not clear yet. It could be that there are some women who benefit from it more than others. For example, women with very dense breasts. This 3D exam acts more like a CAT scan, so it may be better at detecting cancers in those women. But for women who have more fatty breasts, it may not make that much of a difference compared to the traditional method. And maybe it's not worth the increased radiation, which the FDA still says is under their safe standards. And also, don't forget, this is not yet covered by insurance, and it costs another $50 to $75.
Good point. Also this week, a new study from the CDC reports that excessive drinking accounted for 1 in 10 deaths among working-age adults. I know, Holly, you were really stunned by this number.
You know, I have to say, these are really significant numbers, and they are shocking in some way, especially when you consider, you know, the CDC said 88,000 deaths a year can be attributed to excess drinking, and that's for people who are in the prime of their lives, between the ages of 20 and 64. It's shaving off 30 years of life for them. So these are really big numbers.
Are we just talking about drunk driving accidents here and alcohol poisoning, or does it go broader than that?
No, Anthony, that's actually why this study was so really impactful. It looked at it in a broad sense. You know, binge drinking, having more than 4 or 5 drinks at once, is linked with some of the things you mentioned: car accidents, homicides, falls, that sort of thing. But just regular daily heavy drinking, which is more than 2 drinks a day for men, more than 1 drink a day for women, is also linked with health problems that ultimately lead to death, like heart disease, liver disease, and cancers, even breast cancer.
Now, some good news about aspirin. A new study finds men and women who regularly took low-dose aspirin had a 48% reduction in their risk of developing pancreatic cancer. John, there are a lot of people I know who take baby aspirin for heart disease. So what's the connection between aspirin and cancer?
Well, there's some pretty good evidence, and it's increasing, it's emerging, that low-dose aspirin can decrease the likelihood of getting other cancers. For example, colon cancer, esophageal, breast, lung, and even melanoma, and others. Why would that be? Well, it turns out that aspirin decreases the pathways that are involved in inflammation. If you bang your knee, it starts to swell up. You take the aspirin, and it may decrease the likelihood of the swelling because all the inflammatory compounds that are coming to that site to repair it are causing a problem, and the aspirin holds that down. Now, it turns out that those same inflammatory pathways, a lot of them are also involved in creating cancer. And that's the idea, is that you're interrupting, by accident, the pathways that are involved in creating cancer, and that may be important 5, 10, 15 years before the cancer actually develops.
Very interesting. Holly, so should everybody be taking aspirin?
Well, you know, Anthony, it's a tough question. I think it's very clear that aspirin, as John was mentioning, can play a role in preventing cancer. What's not yet clear is who benefits from it, how much they should be on and for how long. You know, aspirin is a real drug and it has risks, you know, from bleeding to allergic reactions and everything in between. So I think our research is still evolving, not just to know that it can prevent cancer, but to know who it's right for.
And now the latest prescription from pediatricians, books. The American Academy of Pediatric says parents should read aloud to children every day, beginning from birth. It's the first time the group has taken an official stand on the issue. The new policy urges doctors to act like librarians and make sure books are available to all families, particularly those with low incomes. And finally, 4 years ago, a young man named Ian Burkhart had a freak swimming accident and was paralyzed from the chest down. Now he's participating in a medical experiment that might change his fate and the fate of other paralyzed patients. Dean Reynolds has more on this inspiring story.
Ian had brain surgery 2.5 months ago as the first patient in an unprecedented medical trial involving surgeons from Ohio State and engineers from Battelle, a nonprofit research center who created a technology called NeuroBridge. The microchip is connected to a port screwed onto Ian's skull. The port is cabled to a computer which is supposed to decode messages from his brain and then beam commands to a sleeve laden with electrodes around his forearm.
Squeeze really tight.
Ian's team assembled in a small hospital room to see if Chad's work of a decade would bear fruit. Would Ian's concentration on that computerized image or the prompting in person from Chad
Open as wide as you can, relax.
be strong and clear enough to send a signal to his hand? The answer took 1/10 of a second to arrive.
It's good. What do you think?
And while it looks like such a small thing, extending your fingers or clasping a spoon, no human in Ian's condition has ever done it the way he just did.
Today was great. I mean, to be able to open and close my hand and do those complex movements that I haven't been able to do in 4 years was great.
That's really stunning.
It's absolutely incredible. I could watch that video over and over.
And this is classic out-of-the-box thinking. Most of the research with spinal cord injuries has focused on repairing the broken wires that are in the spinal cord. Just try to fix them with stem cells maybe or with other electrical stimulation. And these people said, you know what, let's go wireless.
Yeah.
Let's go wireless.
Wow. Dr. Jon LaPook, Dr. Holly Phillips, thank you both.